Welcome to our YouTube channel Nursing Beats. In this video, we will discuss one of the important autoimmune disorders of the central nervous system. The condition is multiple sclerosis. I have seen repeated questions from this area in different exams. So let's start the topic. Multiple sclerosis is an immune-mediated progressive demyelinating disease of the central nervous system. Before that, we should know what is the demyelination process. We all know that there is a fatty and protein materials covers on around and certain nerves in the brain and spinal cord. This covering is called a myelin sheath. This myelin will help to conduct impulses fastly through the neurons. Demyelination refers to the destruction of myelin around the nerves. And in multiple sclerosis, already I told that in an autoimmune disorder, it means our own immune system destructs myelin sheaths of our own neurons. When the myelin sheath is destructed, it will destruct the transmission of nerve impulses. The next is what type of age group is vulnerable to get this condition. The common age group in which multiple sclerosis is seen in 20 to 40 years, it affects females more frequently than males. The main cause of multiple sclerosis is autoimmune reactions, but the sensitized antigen has not been identified yet. As the common cause is autoimmune reaction, we can point out some risk factors which leads to multiple sclerosis. One of the main risk factors is genetic predisposition. Here, studies shows that the presence of a specific antigen, which is called human leukocyte antigen, HLA, on the cell wall may promote the susceptibility to some viral infections that may cause autoimmune response in the body. How the reaction occurs means the amino acid sequence in the DNA of the virus is similar to the amino acid sequence of the myelin. So our immune system may be confused to identify which one is the virus and which is myelin. So there is a chance to immune system cross reaction and destruction of myelin sheath. And factors like fever, sun exposure and stress can also worsen the condition. Next, pathophysiology. Due to autoimmune reaction, T cells in the immune system will be destructed and cross BBB. BBB means blood-brain barrier, which is a selective barrier in between the blood and brain. It will control what product to enter from the blood to the brain. When it comes contact with the neurons, it will be activated by the myelin sheath and produce more receptors from the T cells, and it results in the crossing of more T cells across the blood-brain barrier. So there will be a cell-mediated hypersensitivity reaction which result in the production of cytokines, interleukin 1 and 6, and interferon alpha and gamma. These substances will again dilate the BBB, which leads to the entry of B cells and macrophages into the brain through blood-brain barrier. So when B cells get inside, they will produce antibodies which break the myelin sheath. It results in plaque or sclera in the neurons. As we know, there are a particular type of cells called oligodendrocyte which produce myelin, especially in the central nervous system. But in this case, macrophages will engulf the oligodendrocyte, thereby reduce the chance of remyelination of neurons. So without myelin, neurons cannot transmit impulses properly, which leads to sensory, motor and cognitive problems. Now let's see signs and symptoms of multiple sclerosis. One of the main symptoms is descending pattern of paralysis. It means upper part of the body will be paralyzed first. Then gradually it will go to the lower body parts. This is the typical symptoms of multiple sclerosis. Next is ataxia. It means a problem with coordination. Other symptoms are bowel and bladder dysfunction, impaired sensation, diplopia or double vision, heat intolerance, chewing and swallowing problems, poor judgment and memory loss, blurred speech, weakness, nystagmus, etc. Nystagmus means there will be an involuntary movement of eyeballs either side to side or top to bottom or in a circular motion. Diagnostic investigation used to find multiple sclerosis. First of all, we have to do proper history collection and physical examination to collect the baseline data of the patient. After that, we can go to other investigations. The main investigation is LP and CSF analysis. LP means lumbar puncture. In CSF analysis, the presence of increased immunoglobulin G, that is IgG, antibodies, proteins, WBCs suggest multiple sclerosis. The next is CT, computer tomography, or MRI, magnetic resonance imaging scan for brain and spinal cord. Through this investigation, we can find out is there any atrophy present. Next one is evoked potential test to check the speed of nerve conduction. If there is a slowing of nerve conduction, it is suggestive of multiple sclerosis. Okay. Another investigation is oligoclonal band test. Oligoclonal bands are bands of immune globulins which may be present in blood serum or CSF in case of multiple sclerosis. Last one is electromyography. It is used to measure the electrical activity of the muscles in response to nerve stimulation. In multiple sclerosis, it will be abnormal. So now let's discuss how to manage multiple sclerosis. The medical management is usually symptomatic. It means according to the symptoms of the patient, we can treat. The medications mainly used are corticosteroids, example prednisolone, dexamethasone, etc. Another group of drug using multiple sclerosis are anti-neoplastic drugs like cyclophosphamide. Then immune suppressants like azathioprine and skeletal muscle relaxants like quinine sulfate are also used. The muscle relaxants reduce muscle stiffness and spasm. Amantadine is used to reduce fatigue in multiple sclerosis. Another group of drugs is beta interferons to slow the progress of multiple sclerosis and reduce the number of attacks. Plasma exchange is also used. Speech therapy and physical therapy can be used according to the symptoms, and dietary management include high calories, high protein, high vitamin, low fat, and gluten-free diet should be provided. Fluid intake should be increased. Next is surgical management. We cannot tell that there is an effective surgical management for multiple sclerosis, but according to the severity of symptoms, symptomatic surgical management like thalamotomy, rhizotomy, etc. are to be used. The main complications of multiple sclerosis is paraplegia, means paralysis of legs and lower body parts. Second one is quadriplegia. It means paralysis of all four limbs. Then UTI, and respiratory tract infections are more prone to occur. Contractures also can be happen. It means hardening or shortening of a muscle or tendon, which leads to deformity of joints. In this condition, patient cannot move the joint properly. Next is nursing management. The main nursing responsibility are assess neurological status and vital signs, maintain proper food and fluid intake, providing a stress-free environment, assisting in self-care deficit, providing active and passive range of motion, etc. So this is all about multiple sclerosis. I hope all viewers understood regarding multiple sclerosis, and I think this video will be helpful for you. Be ready to learn another condition in next video. Till then, bye from Shipinchit CP. Thank you.